Welcome to Your Anxious Child, 5-Minute Solutions, a podcast dedicated to providing practical advice and support for parents of anxious children. This advice is informational in nature and not a substitute for a consultation with a licensed mental health professional. And now, here's your host, Dr. Edward Plimpton.
Welcome back to Your Anxious Child, 5-Minute Solutions and Interviews with Experts. Today, we are talking with Bridget Flynn Walker, a clinical psychologist who has published 2 books on anxiety, Social Anxiety Relief for Teens, a step-by-step CBT guide to raise confident and to be confident and comfortable in any situation. And what I was particularly excited to kind of see is that she has written a second edition of her book, Anxiety Relief for Kids, on-the-spot strategies to help your child overcome worry, panic, and avoidance. So, Bridget, thank you for spending the time to talk with us about your work and your 2 books. I wonder if you could just tell us a little bit more about yourself.
Well, thank you for having me, Edward, and it's always a pleasure to talk about my work because I think it can help a lot of people, and I really enjoy it. So myself, um, after I graduated or got my doctorate in clinical psychology, I mostly did traditional talk-based therapy, and I I really had a hard time helping people with anxiety problems, and I didn't ever get any training in graduate school to identify or treat people with anxiety problems. So did a second postdoc, a 2-year postdoc with somebody, a CBT expert, and basically learned how to treat mostly adults then with anxiety and related problems. And related problems include obsessive compulsive disorder, body focused repetitive behaviors, hoarding disorder. So they've changed the diagnostic categories, but they're all very, similar. And so I learned it, and I decided to work with kids because I saw that kids are, untreated anxiety problems can wreak havoc on people's lives. It's associated with lower productivity, untreated anxiety disorders. When someone has one and it's not treated, they tend to never get better, and it tends to hold them back in life in many, many ways, and also lead to a lot of suffering. So for kids, obviously it's a really good place to intervene so they can learn how to manage these problems. And one thing that I find really compelling is that, CBT is super effective. So I like that. It's very effective. So I feel really good about offering what I know about CBT to people to help them get better.
Couldn't agree with you more. And you also bring some expertise to the issue of the challenges that might come up in horseback riding. And can you tell us a little bit about that aspect of yourself as well?
Sure. It's so I have been riding since I was about 11 years old, and I took a several-year break to have children in graduate school, and then got into it quite seriously again about 20 years ago. And I own and show dressage horses at the FEI level, which is, the higher level. And I do it because I love it. I also like the challenge intellectually. But I train pretty seriously. I have a trainer who I take lessons from several times a week. I'll try to ride 4 days a week, 2 horses. I show a lot because I think it improves my riding. So when you put yourself to the test, and you have to show up, and you don't get to take a little 20-meter circle because you didn't do something right. It really makes you a better rider. So I just like it. I love riding, and in in horse show situations, you're often grazing your horses, waiting around. There's a lot of, and it's mostly women, but some men. I've worked with some Olympic athletes who, what I see in riding is either perfectionism. So people have fears that they're not going to get the score they think they should get, um, or they're not going to perform as well as they think they should, or they blame their horses, which is a big no-no in equestrian sport. You don't blame your horses. And then I see that a lot. I also see a lot of social anxiety, which is when people fear being watched riding and fear that spectators will judge them negatively. Oh, like she's a bad rider. The other thing I see is just a fear of getting hurt, right? You see
So,
that a lot.
so horseback riding provides ample material for thoughts about dealing with anxiety. I wonder if we could just take advantage of the fact for a second that given this is the second edition, if we could get your thoughts about what's changed and stayed the same since the first edition of your book.
Mhm. Well, certainly CBT is ever evolving. So, and I think when I wrote the first edition, the inhibitory learning theory, which was kind of discovered in 2015, was there. But times have changed, and COVID really had a huge impact on everybody, but especially on kids. And because they stopped, interacting one on one. And now we have our devices and our social media, um, which are really problematic. So if you have an anxiety problem and you feel uncomfortable walking up to a kid having lunch, well, you can just look at your phone and pretend you're busy. Or you can stay home and never leave your home. And humans don't do well without one another. We're fundamentally social beings. So kids get depressed. They also, if they never face the situations that trigger anxiety for them, their anxiety will get worse and worse. So a lot of kids during COVID, when they didn't go to school, they were like happy as clams, kids who had social anxiety disorder. And their parents were like, oh my gosh, this is so great. We'll never let them go to school again. Well, no, it's not. Um, because then, it comes roaring back. And then the thing about social media is really problematic in terms of perfectionism, body image issues, people comparing themselves to others constantly, um, in negatively. With anxiety is always negative, by the way. It's never positive. It's
Uh-huh.
never like, oh, she and I look similar. Isn't that great? It's never positive. So, our world has changed a lot, and kids are not talking to each other. They're texting instead of having live conversation. Well, if you look at the animal world, I mean, horses, for example, they're very social creatures, just like dogs. In fact, there's beliefs that that's why we get along well with dogs and horses, because they have similar social structures. They need each other. Horses and dogs, if you leave them alone, get super anxious. Um, and so we're kind of like that, you know, and we really need each other. So, this, in addition to lowering fertility rates, did you read about that? uh, is a real problem. Um, and it definitely leads to anxiety problems getting worse, never better.
Do you view the pandemic as sort of adding jet fuel onto kind of an existing trend or charting an entirely different course?
That's a really good question. I mean, look, I'm doing all my work by Zoom. Most of my colleagues do. For me, I moved, to a different, city in California. Um, but most of my colleagues, will do it that way. For me, it's great because I can do exposures with people. but it's not so. I mean, so I think that was because of COVID. But now everyone's gotten comfortable with that, and we've adjusted our lives accordingly. And if you talk to CEOs of companies, for example, and people don't want to come into work, and they'll talk about how it really hurts younger workers because they don't have the mentoring that happens. So it's kind of, I think, a really unfortunate paradigm shift for our culture and world, and for kids especially, right? Because their minds are not developing and or not developed yet. They are developing, sorry. And they don't come out with the same resilience, and they have a lot more fears, and parents have become hyper, they want to be the best parents, and they want their kids to succeed at everything, so they have their kids overscheduled and all this stuff, and that wasn't the way we used to be, right? So there've been a lot of changes, right? And I don't think it's all COVID, no, but it definitely didn't help. And then the devices don't help either.
Right. So one of the things I kind of liked about your book about anxiety relief for kids is that it lays a foundation for parents in terms of there really is a method to how we can kind of help your child. And and you talked about in your book kind of 5 kind of steps involved, and I wonder if you could, just talk about them and help our parents and our audience kind of begin to kind of get oriented in terms of what sort of things they should be thinking about and what sort of tools should they begin to think about in terms of helping their child kind of move in a different direction.
Hmm. Okay. Well, I think it starts with recognizing that there's an issue potentially with anxiety. And I always say, parents know their kids really well. Sometimes nowadays, a kid will go online and realize that they have, like, they'll self-diagnose, and then the parents will be like, no. But I think the steps are, first, what are the situations that trigger anxiety for a kid? Is it going to the park, and is the fear of off-leash dogs? Is the situation raising your hand in class to, when you're to answer a question? Is the situation going on a sleepover? Whatever the situations are, and usually you'll find avoidance, or that is probably that's a real good sign that anxiety is at play. So you have to figure out what the situations are, right? And one of the things that I always ask when I send out monitoring formats to parents, and I ask them, what's the situation? What did you observe about your kid? What did you do in response? And how worried did you think they seemed on a scale of 1 to 10? I call it a fear thermometer. And so already there, if I get that data from a parent and I look at it before I meet with them, I usually know I have some really good ideas about what's going on with that kid. So that's the first step, because not only does it give us information, but we will use it later to plan exposure. So the next step is educating kids about what CBT is like, right? And because nobody on this green earth is going to face the situations that they're avoiding unless they understand why it would be helpful for them to do that. So I use a couple of heuristic devices, the Worry Hill, which was created by Irene Pinto Wagner pretty long time ago. She's still practicing. But it's a really nice way to explain, even to little kids, that, and I don't know. I mean, if I had a picture of it, I could narrate it, but I don't know if that's what you want. But you basically introduce to little kids what the fear thermometer is. Any kid can understand it, even little ones, because you could just make little faces, like scary face, happy face, sort of medium face. And then you explain to them, and you ask them, well, what do you do when you're in this situation? What's your fear thermometer? And they'll tell you. And then you say, well, what do you do? And they say, well, I run away or whatever. And then you sort of get a couple of examples and you explain to them that those behaviors, the avoidance, whatever else other behaviors they do, they're like a big stop sign at the top of the worry hill. And what we want to have done, and then I tell them what we know from all kinds of studies is if you stay in that situation without leaving, you get to be on the other side of the worry hill and be okay in that situation, right? And most kids get that. They really do. They may not love it, but they get it.
Because let's go down.
Yeah, and the stop sign. I always draw the stop sign. It's like, if you stop there, next time you're in the situation, you're going to go right back up there. And there you go. And I say it's like anxiety jail, because it is. And then another heuristic device I use is the candy jar, because you had mentioned the work of Michelle Krask, and we used to think that exposures just made the old learning go away. Like if you avoided over and over again going on sleepovers, and then you finally conquered them, and then it came back. Obviously, those old associations didn't go away. And so what we learned is that we want to stuff someone's brain so full of safe associations that their brains pull that instead of the dangerous one. But that means you got to do a lot of exposure. So every time you do an exposure, it's like putting a green candy into the candy jar as opposed to a red one, which is, this is bad and scary.
So wait. Okay. So wait. We've got this worry hill.
Right.
That we are that on the one axis is how scary something is.
Right.
And then on the other axis is how long you're doing the kind of exposure. And if you get to the top of the hill where it gets really kind of scary and then you kind of drop out or avoid, you never learn about getting to the other end.
Right.
But now you have the second image of a candy jar.
Right.
And there are two types of candy that we're kind of dealing with, Right.
The red or the dangerous associations, like I can't do this is bad. And the greens are a result of being in a situation that triggers your fear and not doing the safety or avoidance behavior or ritual and learning that you can tolerate it, that you could deal with it. That would be a green candy, right? So it's kind of like you explain the worry hill to explain to a kid why it would be worth their while to do this. And then an additional way, sometimes that's enough, but an additional way is to say, yeah, we want to stuff a lot of those green candies into your brain. The more, the better. Because you do have to do a lot of exposures for them to be effective. They really have to be en masse, a lot.
And it's interesting because that simple analogy of the candy jar actually does speak to the issue of inhibitory learning, which is very predominant kind of perspective, kind of recognizing that old kind of metaphors like jumping into a swimming pool and just kind of you'll get used to it, or sucking on a piece of candy until it loses its flavor, you get used to it or habituate, doesn't really hold with anxiety. And what's really needed is to build up new associations.
Right.
So,
because all the behaviors that people gravitate towards to mitigate the feared outcomes of being in a situation that triggers anxiety, those are the problems. It's not the anxiety itself. Is that they prevent people's brains from developing those new associations.
Right.
That's the hugest thing. So it's always, if you have OCD, it's the rituals that are the problem, not the obsessions. It's the avoidance that's the problem, not the fear. And the reason those are the case is because you can't learn anything new. And the reason we do exposures is to be able to learn something new. And so then lots of new learning. And you really have to drill it into people's brains. So anyway.
And interestingly, some of this is actually kind of rather counterintuitive for because as parents, our initial reaction when a child is distressed is to provide comfort,
Right.
and this is not going to be too helpful in the land of anxiety.
Well, absolutely not. And I'm not sure if you're familiar with the work of Ellie Leibovitz.
Quite familiar.
Yeah. So Ellie and we did an event, I don't know, a couple months ago, Ask the Experts, and our approaches are very complementary and yet different. But I attended, I don't know, I think it was 15 years ago when he was researching parental accommodation. And I went to a plenary session of an OCD conference and I heard the data. I was like, oh, well, that makes total sense. So when a parent changes their behavior to alleviate a kid's anxiety, which, as you said, is totally intuitive. In fact, you really can't parent an anxious kid intuitively because you're going to do those behaviors naturally, right? And why would a parent not do it unless they knew, educating themselves that it was counterproductive, right? And still, even when parents know, sometimes it's very hard for them to resist engaging in those behaviors. But I've used his data for a long time. I don't only focus on it. Obviously, I focus on the kid, but it's quite compelling. And to me, it's always about understanding. It's getting educated because it is all counterintuitive. However, if you understand it, don't you think it makes sense?
Oh, absolutely,
Yeah, yeah,
absolutely.
yeah, yeah.
It no, provides a short-term fix, and it's so relieving. The avoidance really works on a
Of course
short-term
it
basis,
does. Sure,
and
sure.
um,
Yeah.
um,
It,
and
it,
it's so hard to get on the struggle bus and tolerate all those uncomfortable feelings.
Right. And a lot of my job is motivating people and little kids even. It's like, well, do your worries cause you any hassles? Because some kids are like, no, I don't want to do this. And it anxiety issues really are a drag and they're not fun. They take a lot of time and energy. And a lot of this is teaching people that there's a way out. And also, I have to emphasize it doesn't have to be a terrible ride on the worry bus. If you go to a skilled clinician and you can gradually, like when I start with kids, I don't want it to be too hard. I do not. I'd rather have them experience it, understand the model. Once they understand the model, that actually when they face the trigger situation without doing their customary safety or avoidance behavior, they can tolerate it. Oh, gee, and it gets easier the next time. So you have to start really, really easy. And that's part of the art of doing this stuff is just start where the kid is. It doesn't even matter. Even if you have to do an imaginal exposure, imagine getting a shot or imagine, it just, it doesn't matter. You just figure out where to start.
And certainly, if we can kind of introduce a little kind of humor into proceedings, it's well known that anxiety is allergic to humor.
Yeah. I mean, it's funny 'cause it, it is. And sometimes it gets ridiculous and people will even laugh at themselves. And and they know it because most people with anxiety problems have insight, meaning they realize that their fears are a little over the top. Maybe not quite as much with little kids and certain disorders not so much, like hoarding disorder, the insight level is quite low. Um um Perfectionism, it can tend to be on the lower side. But you know, that's a problem. If someone does not have insight, the prognosis tends to be poor. But you have to have someone evaluate who really knows what they're doing because little kids will be like, no, I'm fine. No, I don't care. They don't necessarily want to talk about it. So you have to have some facility with talking to kids about this stuff and drawing them out and coming up with topics that they're interested in. Like if I have a little boy who has health related anxiety and the kid loves sports. Well, I'm going to talk about sports and I'm going to use different analogies. You just have to figure out how to develop rapport with these kids too.
Yep, absolutely. Absolutely. Um, so central to this kind of treatment is developing kind of encounters with a feared topic or item, or developing kind of an exposure plan. Um, what should parents be thinking about in terms of kind of beginning to kind of develop an exposure plan, or helping their child basically um, confront what they're afraid of, um,
I
get
mean,
back to school, get back on the kind of force that threw them, whatever.
well, I think, you know, acknowledging that they're scared, um, helps because they genuinely are, even if it's way over exaggerated. Um, and educating them as is appropriate. Um, that's why I wrote the book, saying, well, a lot of people get stuck on worries. Do you think this might be happening? Um, and treating exposures kind of like experiments, like, do you think that if we did this and you didn't do that, maybe something else might happen? Maybe not the thing you're really worried is going to happen will happen. Could we test it out? You know? So testing it out is a little less daunting than let's do an exposure. Could we test it out? Could we see what happens? And could we just imagine that we're in that situation where at the dog park and an off-leash dog runs up to you and I don't pick you up. I don't do my accommodation behavior. Um the kid might say, "Well, what if the dog jumps on me?" Well, it might. Has it happened yet? No. Well, could we test it out? And and if it's too scary, could we test it out in our imaginations? Could we try? Could we go to a park where there's some off-leash dogs, like in a pen, and get near them? I mean, you have to approach the situation. Um, and there's so many examples of that. Like, some kids have the need to know everything that's gonna happen, and they'll ask their parents to write a list of all the things that are gonna happen. And an exposure I will sometimes give that's kind of fun is, like, we're gonna do mystery errands, and I'm not gonna tell you where we're going and how long it's gonna take. And your job is just to be like, "Okay," and then I use a lot of rewards, lots of rewards for kids, because it's hard work. So, and I always teach parents that, the reward should be given as close to when the kid tested it out or did the
Mhm.
exposure. Because kids will tell me, they're like, "I really didn't wanna do that, but I really wanted to earn that Pokemon card," or whatever it is. Um, so rewards are really help with motivation, I find.
Well, particularly for school age children. And certainly that comes up with, topics like trichotillomania, where the motivation to kind of do something about that is often decidedly low in school age children.
Yeah.
But it comes up.
Yeah.
Uh,
Well, body focused repetitive behaviors are a slightly different animal in terms of
yep.
treating them. And it's a protocol that's a little involved. And what parents tend to do is say, stop pulling your hair, stop pulling your hair. And, usually kids will have some motivation, not always, because they don't want kids are noticing there's like no hair there or whatever. Um, but that's a whole different, we don't treat those disorders with exposures. We do what's known as habit reversal training. Same as like with tick disorders. It's different. They're different animals.
Right. So just to returning to kind of the themes of your book, um, one important kind of powerhouse idea you talked about is the importance of personifying the worry, or giving the worry a name or a nickname. And wonder if you could just kind of talk about why that can be such a valuable part of the treatment.
Sure, sure. I think it's a simple intervention, like many are, that packs a pretty good punch, because by nicknaming a fear, we we don't want to have a kid or an adult who's dealing with anxiety to like hate their anxiety and want it to go away. Because the more someone wants something to go away, the more omnipresent it's going to be. Like I'll often say, imagine there's a little pink mouse in the corner on the floor, but don't think about it and don't look at it. That's all you're going to think about. So we want to foster an attitude of acceptance. So what I do is have kids say, "Hi, worry dog." Hi, worry wart, hi, whatever it is.
Mhm.
So that helps them adopt an attitude of acceptance. But secondly, it also starts to help them objectify what's happening, because anxiety comes in spikes and it can be really powerful, and it's related to the activation of our amygdalas, right? It's sort of like a horse bolting,
Mhm.
taking off with you. And so it lends some objectivity. It's like, oh, okay, this is happening. And it also, thirdly, helps parents, gives parents a way to communicate with their kids without accommodating. So rather than saying, "Oh, Johnny, you don't have to go to school today. You have a stomach ache. I know, even though I know you won't throw up, I'll let you stay home." Um, a parent could say, "Hi, is that worry dog? What's your fear thermometer?" That's another way to objectify these things. And because those things really help. So there's all kinds of little things that we do in CBT that pave the way for the kind of learning we want someone to have, that an anxious mind is not very good at learning. An
Right.
anxious mind does not learn from experience. It just doesn't. So from all the times the bad thing didn't happen, an anxious mind doesn't learn. That's why we kind of have to do all these, we have to go to these extremes to provide that opportunity for the mind to learn.
Well, they don't learn from experience because their avoidance kept them safe.
Partly that, but it's more than that even, because inhibitory learning is based in learning theory, and there needs to be emotional content in learning. That's why talking about anxiety doesn't work to help you. You need to have that experiential piece for that kind of learning. It's like sports in that way. You can't just talk about swimming and become a good swimmer. You can't talk about riding or read about it and become a good rider. So you have to experience it over and over. And yes, you're right. If you avoid, you'll never experience it. But it goes even deeper than that.
I wonder if you could just expand upon that, because I think that's an important point you're making with regard to the choice of treatment and how, because I think often people get misled or waylaid by kind of an approach that involves just talking about kind of anxiety and not actually, you know, um, doing something concrete and action oriented.
Mhm. So the question is, I'm sorry, I'm
I'm hoping you could kind of just expand on the idea about why it's, say, different from other types of therapy. In that talking, you're not going to think your way out of anxiety. You're not going to talk your way out of it. It's something else.
right. Well, first of all, a lot of what happens in talk therapy with someone who has an anxiety problem is a lot of trying to rationalize why the person shouldn't be afraid, or dig into stuff about their past to explain why they have anxiety, which is very, very dated conceptualization of anxiety. I mean, we know that anxiety tends to run in families a lot, and it's not typically caused by trauma. Um, and and so it's, I mean, so there's a lot of dated theories out there. And if that's the theory you adhere to, well, it's not going to help with it. And the proof is in the pudding. If you don't get better, like I start right away doing exposures. Usually by the second session, I'm on it already, because I know I have limited time. I have, and studies show that the first 6 sessions are the most impactful for anyone.
Mm.
So I have limited time. And that's not to say that I only treat people for 6 sessions, but I know I have to really move the meter for people to experience it. So why that is probably too complex for this discussion. But maybe if I give you another example, it will shed light on the type of stuff that I'm talking about. So, for example, when you treat people with chronic pain, um, what they sometimes do is they start to change their behaviors because of the pain. If you have back pain, they might stop twisting a certain way, or they might stop other movements. And what that does is it tells the brain, Houston, we have a problem. We have a problem. And this is all happening not in our conscious awareness. And then our brains then start to pay attention more to the pain, and we start to perceive more pain. So, and Aaron Beck, who founded cognitive behavioral therapy, I mean, he was studying Freud's theories, and basically he didn't find any evidence to support them. But what he did find is people make all kinds of thinking errors. He called them automatic thoughts, and that people aren't aware of them. People catastrophize or overprobabilize, all these things. And furthermore, that our brains believe our thoughts, right? And that our emotional response lines up with those thoughts. So it's not a conscious thing. It's like we have to re-experience it, without avoiding or other behaviors that block that ability to learn. So it is a real experiential thing, and it's not I would say, well, your brain has to learn, not you, right? Because you know already, but your brain just didn't learn yet. Yeah.
So central is obviously finding a way of encountering kind of your fears. Now, I think it would be helpful for our audience to kind of hear about how you might kind of break down a problem in terms of developing an exposure kind of hierarchy or ladder. And perhaps since you have unusual expertise with regard to horseback riding, I wonder if you could use an example of from horseback riding,
Sure.
to illustrate how you think about an exposure kind of hierarchy and the like.
Sure. So let's take an example of, because I just spoke to a woman who wanted help with this. She has a fear that her horse is going to take off with her, right? And of course, that's, people worry about things they can't control, generally speaking. Like, it's really common for people to have emetophobia, fears of vomiting. It's all the stuff that we can't control that we become fearful of. And horses, they're bigger than us. And so you have to learn to manage them. So for this particular person, she had a fear of her horse bolting. And so I break down the situation into, okay, I'm thinking, I know when, because when it's likely to start. And so I go, so I asked her, well, what do you do on the mounting block? So when you ride horses, you get on a mounting block and you get on. And if you have a horse that you're worried is going to take off, you might be very tentative at the mounting block, right? And you might sit there and put your foot in the stirrup and see if the horse moves. Well, horses are, basically you're teaching your horse to move around a lot and to be tense, because a horse is sort of like an auxiliary brain. And if the way we manage them, they can learn to become afraid. And they're just sitting there going, well, what's she doing? Why? What? So they don't get the message. She wants the horse to be still, dead still. But by being tentative and not swinging her leg over, because once she's on, and then maybe the horse takes off. So I would start, in fact, I would start with that. It's like, approach the horse, stick your foot in the stirrup, leg over, no delays, none of that. And I might have her start with someone probably hold the horse. She won't care, but she might still have distress if someone holds the horse too. So I would figure out individually. I haven't started with this person, but what would your fear thermometer be if this person is standing there and you just do it like that? And I'd have her do it like 10 times. Not all at once, because the horse is going to get bored. But so I might start with that, right? Then I might, sorry.
Yeah, well, it's interesting what you're just saying, though. because you just had been talking about how if we have certain thoughts, our thoughts can then kind of make us anxious. What you're saying here is here's a different domain where our physical actions can make, I think actually applies both with kind of humans and with, human horsemen. Our physical actions, if we're acting in a certain kind of tense, nervous way, we're communicating to the horse. There's a problem here, Houston, and
Yeah.
I want you to be on alert. It's a different way of, it's a sort of an interpersonal kind of
Right.
communication, but has the same effect as how we talk to ourselves. How we act physically
Oh, yeah.
indicates the horse
Behavior.
that there's a problem here, Houston.
Right. Well, a lot of kids, athletes will, like, if they're perfectionistic and worry about making mistakes, they will just not take the ball in soccer. And, or if they're perfectionistic and a teammate makes a bad shot, they might yell at them because they're so worried. So it's very much behavioral, and that's the easiest to deal with. Cognitive behavior, you can't, in my opinion, the way you change people's thoughts is by changing their behaviors.
Mhm.
Cognitive restructuring, especially in little kids, in and of itself is not going to be effective. They have to experience these things, and then their thoughts change. Does that make sense?
Yes, absolutely,
Yeah. Yeah,
absolutely.
yeah. So that's why, talking doesn't do much, right? And I can't tell you how many parents I get this all the time. Well, my child is a really old soul. He's really verbal. He can tell me all about his anxiety. I'm like, yeah, I'm sure he can.
Mhm.
And understanding what you're afraid of is going to do you absolutely no good. You will never conquer your fears if you talk about it and know every aspect of it. You got to get out there and do stuff to test out, and not do those behaviors and test it out so you can relearn.
Yeah, and really learn at the kind of visceral level about
Yes.
the transitory nature of kind of all fears and all, and, so many feelings.
Right, right. And what I always ask is, well, how did that go? Did what you were most worried was going to happen? Yes or no? Usually no. And I'll say, well, what did happen? And then I'll say, well, what did you learn? That's a really important piece of the learning disabilities, if you will, that people with anxiety problems have, in that they don't learn from experience. What did you learn? Oh, I learned that I could tolerate it. That happened to me with someone today. I learned that I could tolerate not knowing, because at the root of a lot of anxiety issues is just a low tolerance for uncertainty. I learned that, okay, I could stay in the situation and not know what was going to happen. Um, so there's a lot of things you can learn, and you always want to be like, and then what? Because there's a tendency when people get triggered, it's like they forget that they tolerated it, and then they're just looking for the next problem. It's like they have a big antenna strapped to their head and they're looking for bad stuff. And they forget that they tolerated it. They forget the goodies. They don't see the good parts, that they handled a situation. So you really have to help them see that without saying, see, I told you nothing bad happened, right? Yeah.
Yeah. Um, I certainly encountered this issue in kind of a slightly different domain of kind of needlephobia, where children can have a successful experience and say, "Oh, that wasn't, that didn't hurt at all," and yet 6 months later have trouble kind of remembering that when it comes around again.
Right.
It's quite variable in terms of how children respond after a successful experience. Sometimes they really remember that. Other times it's kind of deja vu all over again.
Well, right. The part of the problem is that you don't get injections very often, right?
Right.
So when you have a kid with a needle injection phobia, you gotta beef it up again before um before they get a shot. And I used to do I haven't done it recently, but I would do the whole thing where I'd put paper down and I'd have syringes and do the alcohol and then I'd have parents practice and I'd poke them, not with needles. Um, but they usually will need boosters because
Right.
if they only do an exposure once in a blue moon, that's not enough. It's never going to be enough, right?
Right.
Yeah. It's just, you need to do them en masse. A lot of them.
Yeah. I thought you made kind of a very interesting point about developing and identifying kind of triggers and exposure kind of hierarchy,
Right.
in that it's really a useful idea to identify a triggering situation and then to even break it down a little further in terms of a sub trigger, I think is your
Yeah,
phrase.
sub situations. So if a big situation is, for example, going on a play date, and you kind of have to understand, okay, well, what are you worried is going to happen on a play date? And believe it or not, some kids are worried they're going to be bored, um, or they're worried that their friend won't want to do the things that they want to do. And then you have to ask them, well, what's going to happen if that happens? And so, and sometimes you'll get a kid who says, well, if I have to go to the bathroom and I don't know where the bathroom is, they feel uncomfortable asking. So you kind of uh, make the situation bigger and look at all the little parts that comprise a situation. It's like, okay, well, what's involved in it? It's knocking on the door or going home in the car. So you break it down into just all the little aspects, and then you ask about each aspect. How hard is that part? And then you'll get like the ding, 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 the parts that are really hard. And sometimes it's few parts. I don't know if does that make sense to you?
It
You
makes full sense. I think that we don't always know what the kind of true fear is about, and
Right.
particularly with children. But there's also another way in which I think what you're saying is important, which is um, a major obstacle I see is parents and also therapists getting caught up in the excitement and urgency of the situation and jumping too quickly to what they think is the solution, and not necessarily breaking things down into kind of incremental steps where the child can kind of really master them, but just thinking, okay, it's a fear of birthday parties, and the urgency, we've got to do something about that. Not really breaking down the situation, in part because they're so urgent to kind of get the child to the birthday party or whatever it might be, or back to school, or back on the horse, or whatever.
Right, right. You do. I mean, like with a birthday party, what are all the parts of a birthday party? Maybe what scares the kid is that they get him a present and the other kid doesn't like it. It's really hard to know. And it's always best to break everything down. And anybody who has a lot of experience working with little kids and adults for that matter, you have to do that. And plus then you understand what the true nature of their issues are, and where we can start, because I will not give an exposure assignment unless I know someone's very confident they can do it. I never say just try this. Never.
Right.
So I will do it with them first, um and I'll ask them how confident they are, and I'll send an action plan. Basically, I'll say, well, when will you do it? How often will you do it? And with little kids, you got to get the parents to be supportive and reward them. And it's a lot of different variables
Mhm.
to consider. And it's hard work working with kids, because you have a lot. I mean, it's harder than with adults, that's for sure. Um, but they're kind of fun. Uh,
Well, I would entirely agree, and I think in some ways having success with kind of children is much more gratifying.
well, because you impact the rest of their lives, right?
Well, yeah, yeah.
Yeah. And you see them change, and you see like who they really are, and you know that it's in there somewhere, and that is just the best, right?
Yeah. Well, in the pediatric practice that I work in, frankly, we all talked about how it's just such a incredible rush when we get a child to successfully vaccinate. It sort of makes our day. You know, it's
Yeah, one time I work with a lot of pediatricians, and my boys they were raised in San Francisco, and I went in with one of my sons, and I got like the star treatment. Oh my gosh, it's Dr. Walker. She cured this kid and this kid of needle injection phobia. And I said, well, it's not that complicated. And they said to me, well, that's what they say about gynecology. And well, that's why we all have our areas of expertise, right? Anyway, I've got to run now. What a pleasure, Edward. Thank you.
Well, thank you and just kind of quickly, where can people find out more about your work?
Well, if you Google me, Bridget Flynn Walker, PhD, I have websites. I've written a lot of articles or blog posts for Psychology Today. Not so many for kids, more for adults in Psychology Today. But my books are available on Amazon, Anxiety Relief for Kids, the second edition, and Social Anxiety Relief for Teens. But if you Google my name, Bridget Flynn Walker, PhD, I come up.
Well, thank you so much.
Thank you.
Thank you for listening to Your Anxious Child. Please leave us a rating and review in iTunes to help us get the word out. If you'd like to learn more and find additional resources, visit us at edwardplimpton.com.